In November 2010, the Society for Minimally Invasive Spine Surgery hosted its annual meeting in beautiful Miami, Florida, where the Society experienced its largest participation to date. Surgeons spent the first day of the event in the lab, followed by 2 days of educational sessions, where the participants were exposed to the latest data, research, and discussions regarding minimally invasive surgical techniques.
The excitement here in Miami, I think, is number one, it's bigger, it's better, and it's improved. So we've done everything we can to make this an excellent facility. I think at this point we have finally reached the tipping point, or we finally reached the point where the general people who are doing spine surgery, who are interested in the best possible procedure for their patient, are now interested in minimally invasive spine surgery. There was tremendous excitement about just being in the lab, and each person that was there stayed there from 8 o'clock in the morning until 5 o'clock at night, doing as much as they possibly could.
As we grow, the field of MIS will grow proportionately, and that puts a big onus on the society to maintain its credibility, not only to promote our efforts as a society, but to look beyond that and really look at the mission statement, which is to, in the end, improve care for our patients. And an important set of goals for the society is, number one, to create a prospective registry so that we can understand how patients are doing, learn from our experience how we can do things better, and obtain the clinical data that we need to show what works and what doesn't with MIS. And I think the prospective registry program that we're launching this year will be very important in that sense.
It is amazing how this technology has advanced. It is amazing how industry has embraced this, and also our patients have embraced it just based on simple outcomes of these procedures. What I find probably the most unique about this experience this year is the fact that I've been doing these techniques since their infancy, and now I see the next generation begin to do those techniques, and I get to sit back and listen, and it excites me because each generation takes it to a newer level. So I see the excitement in individuals.
For somebody like me who's studying and trying to do leading edge research and techniques, it's always good to know and hear your colleagues say, what they're doing, and sometimes it's just merely just a reassurance. And I think that, industry is a big part of this, because the change and the reason for the current techniques to have had the sustainability and the current longevity is because of the development of better technologies and abilities, and I think that's going to continue to grow. So there's a true entrepreneurial and innovative spirit with MIS surgery.
Our role has been to really get everybody, the leaders in minimally invasive spine surgery, together. And that's an interesting prospect, because spine surgery is really divided into orthopedics and neurosurgery. We discuss patient outcomes. We discuss how to improve our practice. We discuss how to improve patient care. We discuss what we're going to do at next year's meeting. And we talk about the things that are important to us, and those are important to our patients, because we're trying to provide them with quality, minimally invasive care.
I've been blessed with being able to work with some of the most brilliant, caring, compassionate, and motivated people I've ever seen. It's easy to be passionate about something that is good and positive and affects the world around you in a way that makes you feel good about the things that you're doing. So when you're on a winning team, it's very easy to be motivated.
This year, the 2011 Society for Minimally Invasive Spine Surgery annual meeting will be held in Las Vegas, Nevada on October 21st through October 23rd. We hope you'll join us for what is sure to be an exciting and informative event. Visit the Society online for up-to-date information on the 2011 annual meeting.